Hi, welcome to this short talk on how to answer questions on your clinical placement. This is a key skill. My name is Matthew Links and I'm the Discipline Lead for Medicine at Bond University, and I'm coming to you from Kombumerri country here on the Gold Coast. We all know being asked questions by your supervisor can be scary, but it's important to remember that medicine's a public performance. We usually do our work in teams and other people can always see how we perform, so we need to get used to it. This is an opportunity to make a good impression. However, the flip side is it's also possible to make a bad impression. But you need to remember this is just one moment in your placement. If you stuff up, you can make it up. Making no impression is a really poor option. The most important thing to remember is that answering questions well is a skill that you can practice and learn. Now, there are lots of things you can learn from the process of being asked questions, apart from just the specific content being tested. You can learn frameworks and principles from the answers that are provided to you about specific points. You can learn what the supervisor thinks is important. There's no end of stuff to learn, so you really need to understand what is important. You can also learn how to cope with not knowing the answer and how to learn how to plug your knowledge gaps by doing the research about the topics that you don't know. The first step is you need to be brave. You can step up or you can hide, but if you hide, you're not going to learn. Why don't you reflect on how you've done so far? Have you been brave? Do you need to step up more or perhaps less? How do you cope when you don't know the answer? Finally, make a commitment to step up and hold yourself accountable to this commitment. Preparation is really the key. You can anticipate some of the questions you'll be asked. If you're doing a hepatology term, you should be able to answer questions about hepatitis. You can practice in low-stakes situations. Practice with a buddy, answering questions about the causes of liver disease, or practice in front of a mirror. Learn frameworks or mnemonic that can help you and you can lean on in a stressful situation. You might use a pathophysiological framework, such as portal hypertension can be pre-hepatic, hepatic, or post-hepatic, or you might use a 5 common causes framework. Understanding the causes of abnormal findings and knowing your drugs are two good places to start. Try and maximise the source of feedback. Buddy up with a peer and give feedback to each other on how you have answered questions in the tutorial. Once you have to perform, the first thing to do is take a deep breath and pause. Clarify the question if necessary. State what you know, even if that's part of the answer, and admit what you don't know. Don't pretend. Commit to look up what you don't know. It's helpful to use structures and state principles, and then ask for feedback. The next step is to process. Allocate some time each week to reflect on how the placement's going and think about how you went with answering questions. Are there any gaps in your knowledge and how did you go about filling them? How did the process of answering go? Did you use your structures? Did you get anxious? How did you handle the emotion? The chance to process what happened is the key to being able to improve. Finally, you should document your performance. You need to prove that you've done the work and give evidence to your supervisor that they should give you a good mark. Keep track of the cases in your logbook. Document the learning that you did to follow up. Let your supervisor know what you've done, that you've done the homework, and follow up with a supplementary question. At the end of the term, you can bring your logbook and share it with your supervisors and show the way that you've been following up and learning from the questions that they've asked. So answering questions skillfully is a key thing to learn in your clinical placement. Start off, you be brave. Then you need to prepare, perform, and process. After that, it's just practice, practice, practice. And don't forget to prove what you've done and that you've done the work. What are you going to try and do differently? Take one of these tips and try it out. You can learn to make a good impression through answering questions well. Here are some references. Please visit my other talks and leave a comment or request for topics. Good luck.